Thank you. So following Lauren and Tom, clearly I need to start to exaggerate my opening a little bit more in terms of my accomplishments. It's a bit vanilla right now. The one thing, so in the opening of this section, it talks about the responsibility of healthcare shifting to individuals. Do we really understand what people need? I'm actually here to answer that question in 15 minutes. And so if you hear anything that you don't agree with, just remember, I'm the messenger. Okay, so do not throw egg sandwiches at me if you don't fundamentally agree with what I'm about to say. But as John mentioned, I'm sort of operating right now at the intersection of traditional healthcare companies and non-traditional healthcare companies. And for a dramatic effect for a moment, I think we're at a crossroads in our industry. I think where we are going to look in the next 10 years is going to be dramatically different than the way we look today. It is hard to argue with the innovation that has occurred in health medicine over the last several decades. I wouldn't dispute that at all. The innovation that I think that really needs to happen is in the business models of traditional companies. And so what I want to share with you is some research that we've done with consumers to better understand how they want to consume healthcare. And I use the word consumer very loosely. We represented patients, both chronic and acute patients. We represent the healthy as well. I will use the word consumer to represent the entire population because I believe the scope of healthcare really does get to the health plus healthcare equation. And so this is not to eliminate the relationship between the patient and the provider or the patient and the physician. Those are very important relationships. But I wanted to think about it in the context of consumers as they become more the purchaser of care. And by definition, a consumer is one that purchases a product or service for their own personal use. So with that backdrop, all we have to do is look to other industries that have gone down a similar path when they move from an analog world to a digital world, just like we are with healthcare. And these industries, such as financial services, retail, they specialize in meeting customer and exceeding customer expectations to build brand loyalty, product loyalty. They often talk about lifetime value of a consumer. Those are words we don't really talk about in healthcare at all. And why is that important? Well, when you think about how you and I engage with our banks these days, or how you think about setting up your own travel, when's the last time you walked into a travel agency to book your own vacation? I do it myself online. When's the last time you cut a paper check to pay for your utility bill, your phone bill? How many of you actually have a phone bill anymore? You probably use your mobile device instead of your landline. It's actually kind of scary to think about. We've sort of seen the invention of the CD and the decline of the CD in our sort of lifetime. It's kind of scary, the pace of innovation that's happening in these other industries. And so why is this relevant? One, these new entrants, by definition, new entrants are non-traditional healthcare companies, are taking their lessons learned, their understanding of how to engage consumers in unique and innovative ways, and they're applying it to healthcare. That's somewhat scary, I think, for traditional healthcare companies that don't do this. The second thing is, from a consumer standpoint, their expectations have already been set. Their expectation around 24/7 access to information, being able to make decisions on their own based on information that's presented to them, being able to go online and check reviews, that is their expectations. And I think healthcare is going to have to align to those expectations as we listen to what the consumers are asking. So one of the things that we did, as we think about what we would characterize as a new health economy over the next decade, this sort of journey to reinventing the way we provide healthcare to our consumers, we think about 5 trends. And these are trends more oriented around the consumer. So I don't want to necessarily get into policy and regulation. Those are very important trends and influences into the industry. But these in particular are ones around the consumer. The shift in demographics. The consumer becoming more empowered. We're asking them to take more responsibility. We're asking them to bear more of their costs, reach into their pockets and pay for care. They're becoming more of a more empowered constituent in that matter. The implications around social, mobile, analytics, and cloud computing, that innovation, what does that really mean to our industry going forward? And then when we look at new entrants, I'll touch on a little bit more about what they're doing and what that means in terms of partnership potentials for traditional healthcare companies. And the last is care anywhere. I fundamentally believe healthcare is going to become similar to where other industries like publication, education, they became a decentralized model where I don't only have to go to one location now to get the care I need. I might go to a retail clinic for some parts of it. I may go to my primary doctor for some. I may do some things at home now in a more do-it-yourself model. So these are some of the trends that we've been looking at. And in looking at those demographics, for example, is we're not getting any younger. 21% by 2050 of the population will be over 60 years old. Medicare spending in the next decade will double to $1.1 trillion. These are significant in terms of the shift in the age of the population. The second interesting thing is we've been watching sort of the population with Hispanics. Since 2000, the population has grown 43%. They are the single most powerful purchaser of ethnic groups in the US, and last year purchasing $1.2 trillion of goods. And then, of course, you think about the coverage of the potential of 10 million Hispanics being covered through the Accountable Care Act. Those things are really interesting, but to me, another really interesting, relevant perspective about this group is their use of mobile and social media. They're likely to use and engage in healthcare through those channels more than the non-Hispanic groups. And I think that is significant, again, when we're talking about engaging consumers, helping them get the right health and healthcare solutions, helping them realize, well, maybe they don't need to go to the ED for certain things. Maybe there's another channel that they can leverage that's a lower cost but the same outcomes. Consumer empowerment. So we surveyed 1,000 consumers, again, broad range, many ages, chronic patients, healthy, et cetera. We asked them, what would their appetite be to explore certain types of treatments in non-traditional ways? You can see the statistic. 82% said, I'm very interested. 64 said, if the price is right, of course. But 18 said, I don't care what the price is. I just want something that's more convenient for me, that's easier to access, that gives me choices. One example of this is where we see the popularity of retail clinics coming into play. Since 2007, back then, 1 out of every 10 individuals had visited a retail clinic. This year, 1 out of every 3. One thing that signals to us is the retail clinics are providing convenience. They're changing sort of the model in terms of availability around the hours. I don't know about you, but I have 2 young daughters. They never seem to get sick during office hours. In fact, one of them got sick on Sunday morning before I left for the conference. And so it just seems to happen that way. And then the other thing around it is the transparency around costs. When you walk into a retail clinic, you know exactly how much you're going to owe. The other thing about the consumer empowerment is they're becoming more savvy users. 42% of them want to shop for health care online. And brand is not the only thing that's going to generate loyalty. In fact, 34% of them said they would be willing to switch providers if there was a better experience somewhere else. I think that's telling because most people talk about the strength of the relationship between the patient and provider, which is very true, but loyalty only goes so far. It's an experience that they're looking for that meets their needs, meets their preferences. They want to be able to choose. Again, if we're asking them to take on more responsibility, they need some options. When we look at the technology aspect, we did a piece around mHealth a couple years ago. We surveyed physicians and health insurance companies. Almost 60% of them recognize the importance of the app, the mobile platform and the apps. However, less than 27% of them encourage patients to use them. And then we will look at new technologies today. These are 3 of them. I don't know if anyone in the audience represents these companies, but these are really interesting companies because I think this is where the disruption is starting to happen in healthcare, whether it be price transparency. $400 million in the last 3 years in venture capital funding has gone into transparency. I know some of the health insurance companies are doing this for their members, but that's just their membership. Again, this is about expanding into the entire population that want to start to shop more for their health insurance. When we look at these other devices, they start to shift it into more of a do-it-yourself model. The one in the middle is an otoscope. I can hook it to my phone, take a picture of my ear, send it to a service that will evaluate if I have an ear infection or not. The puck-like device is something I hold up to my temple. It reads 5 major vital signs, blood pressure, temperature, all goes in my phone, can be sent to my doctor, like that. And by the way, I can gather this information every hour of every day if I want to, as opposed to once a year when I go to my annual checkup. So when you think about the availability of data, it's going to grow exponentially. Disruption of new entrants. So who are these new entrants? So we use the word to define the non-traditional company. This is not necessarily companies that are new to healthcare, but a lot of them are. Some have been doing healthcare for a while. Of the Fortune 50, 3 out of 4 companies have some role in healthcare. 24 of them are considered new entrants. These are retailers, financial services companies, telecoms. This is in the US. When you look globally, it's pretty astonishing when you see telecom companies that own hospitals, or consumer device companies that own hospitals and retail stores. Why are they doing this? Well, one thing is they understand how to engage a consumer. 2, they look at the $2.8 trillion money bag in healthcare and say, how do I get me some of that? And so I think it really is interesting the way how some of these companies are approaching it from not only just in the standpoint of leveraging their ability to engage a consumer, but they're going at it through a channel that's less regulated right now. They're focusing on the health side of the equation, the wellness side. It's almost a $3 billion industry when you think about fitness and nutrition. And so they're coming in it from the corner because, again, consumers are reaching into their pocket and paying for it. There's no question about, am I going to get reimbursed for this or not? They're selling it based on a value. So obviously wearables is something that's been talked about a lot. It's yet to be determined how much the wearables will play a role in the clinical side. But I certainly think you're seeing the consumer devices trying to come upstream, and the med tech companies are looking to come downstream a bit. And we're going to see some of this intersection happen. When you look at the venture capital money that's gone into hardware for medical devices, it's dropped dramatically in the last several years. The software has gone up quite dramatically at the same time. Smartphones are becoming a wearable device. Care anywhere, anytime. So part of the research we did, we asked a series of questions. And usually, if the form wasn't this large, this is where I'd ask for class participation to see sort of where each of you are in your use of these types of things. But the questions we asked for 12 to 13 medical procedures. So nothing outrageous. We're not talking about open heart surgery in the grocery store or anything like that. These are simple things. Just to gauge interest in leveraging the technology. And oh, by the way, the technology also is available. So this is not that futuristic. This is right now. Some of them are going through FDA approval still. But the reality is the technology is here. So the first question we asked is, would you use a home diagnostic kit to test for a strep throat? We got 60% of the consumers we surveyed, again, 1,000 consumers that we talked to, said absolutely. When you start to translate that into, there is already a research company that has identified a simple 5 questionnaire that they can ask people before they decide to go into a doctor to determine if they should to get a strep throat tested. They believe just by asking these simple questions, they can avoid 800,000 visits a year. Seems like a good opportunity for an app. Would you use a mobile device to check your ear infections at home? 1 out of every 2 said yes. And again, that otoscope that I showed you is available. It's going to be retailed for, I think, $199, hooks to your smartphone. Ear infections annually run anywhere between 15 to 30 million office visits today. So even if this device isn't the primary visit, imagine what it could do for the follow-up. So instead of taking your kid out of school again for the follow-up, you just take a picture and send it to the doctor. Digital skin conditions. So I know a lot of people actually do this already and they post it on Facebook. And this is not about selfies. This is not about all that stuff. This is actually legitimate. Take a picture, send it to your doctor, have the doctor diagnose it before coming in. Again, 1 out of every 2. Very interested in it. So when you think about it, today, there's already online services that offer the ability to evaluate it and even connect you to a doctor to take care of it. And we asked more. So again, we asked 13 of them. Anywhere from having a wound checked at a retail store to doing chemotherapy at home to even an MRI in pharmacy, and you can see sort of how the distribution occurs. So what does this mean? So who cares? Well, when you start to think about just these 13 that we looked at, it translates into $64 billion in revenue today for providers. Around the corner from that is the $50 billion lab and diagnostics industry that is going to be disrupted as well. So this is small relative to the $2.8 trillion equation, but 10 years ago, this was zero. Zero. Sorry. So then you're saying, okay, Vaughn, this is probably the tech savvy and the ones that are, their heads buried into their smartphone. In actuality, if you look, in the age range of 35 to 54, 50% of them said they would absolutely explore. If these were available and the equation around getting things reimbursed were figured out, they would absolutely do this. And it sort of makes sense, because this is the age group that's likely taking care of their kids and likely taking care of their parents while trying to hold a job down at the same time. $10,000 a year comes out of their pockets for healthcare alone. So it's the single largest expenditure that they have. So they're very interested in understanding how to engage in healthcare in a much different way that aligns to their time frames, their preferences. They want choices. Certainly price is a factor, but it's not the only factor. And I think when you look at where new entrants are playing, particularly those that are in the retail setting, on average, an American will spend 60 minutes a year with their primary care physician, yet they'll be in a retail setting, either physical or online, 40 minutes a day. So when you think about the platform in which you can engage a consumer, to really have a dialogue with them, to help them understand how they can take responsibility for their care, what options they have that are affordable, I think it really changes the way we think about the business model of healthcare. And again, sort of strategies around that, anchoring around the consumer. Innovation is an important aspect. I talk to a lot of clients about innovation, trying to figure out how to make it something that is part of the conversation on an annual basis as opposed to just a pet project in the corner. The new entrants, especially technology companies, they innovate all the time. They're constantly learning quickly, failing fast. And to me, in healthcare, that's a bit scary, because they're trying to apply that same concept into healthcare, and they have a distinct advantage. Analytics, we talk about big data all the time. This is really about driving to real insights that are at a consumer, individual level to really help them make the right decisions around not only their health, their healthcare, but also their financial decisions. And then, of course, operational agility, being able to evaluate your business models in a way that it's okay to maybe get out of the business of something that you've been in for decades, because there may be another channel that's easier to serve. But the focus needs to be, again, be back on how to create a differentiation through the experience that your company provides. Thank you.
One quick question, Vaughn. The opportunity for getting that $64 billion in revenue, part of your measurement is in reducing doctor visits, right?
Right.
Is that necessarily a good idea? Is that probably the right way to measure it, in the sense that maybe interventions with doctors is a good idea in some instances, maybe not for the ear infection, but people should be visiting their doctor, just maybe not for that. Describe a little bit about the quality of the doctor interaction as a way of improving people's consumer sort of choices and options and savvy.
Yeah, that's a great question, because I didn't clarify that in the opening comments, but the one thing that we want to emphasize is a lot of this isn't to replace the role of the physician. It's to maybe change the focus for the physician in their role. Because again, as we look at the shortages of physicians and where they're spending their time, some of this technology allows them to actually understand what's happening with their patients when they're not in the hospital setting. So when we talk about these new entrants coming into healthcare, we often tell them, you can't go at it alone. This is about a partnership with the institutions on how to think about transforming the way we provide care and the way we think about the delivery model in itself, but it's not necessarily substitution. Now, certainly some of this is getting away from maybe those visits that aren't necessary anymore, because they may go into the ED when they didn't really have to. There's some element of that, but I think it's also around the consumer is asking for certain things. Expectations have been set by other industries. Healthcare has a long way to go to align to those expectations. Traditional companies can't do it alone. New entrants can't do it alone.
And doctor consulting on remote sensing, it would be a good idea.
It'd be, yeah,
Right.
exactly.
What's your vision of a healthcare setting that would deliver as much of the services and the kinds of things that we get from so many different places now? What's your kind of dream vision of a place where you would go that would work fabulously?
Yeah, that'd be great. So I think.
Is it like an Apple store?
It's something where there's a place that sells the overall experience. So right now, even with the new entrants, and you have the retail clinics, you have the urgent care centers, you have the academic medical centers, you have the do-it-yourself models. It's going to feel even more fragmented before it gets fixed, right? There's the companies that know how to sort of pull that together and create an experience. So if I am talking to a patient and I do think a device is ideal for them and there's these two apps, that whole conversation happens at once, as opposed to, hey, good luck, go figure that device out on your own, and then go download one of the 40,000 apps that are available for healthcare and see if it works for you. But it's more of an experience that's being sold as opposed to just an individual product or service, and it's sort of pulling it together for them.
So the next few years are going to be chaotic.
I think,
and
yeah.
It's going to be up to certain players to really consolidate the experience, and that's going to be maybe a decade down the road.
Yeah.
All right, thanks, Vaughn.
Thank you.